Hello everyone. In this video we'll discuss about the thrombocytopenia. Thrombocytopenia is stand for the decreased platelet count less than 1.5 lakh per cubic mm or per microliter. Normal platelet count is 1.5 to 4 lakhs per cubic mm. What are the causes of thrombocytopenia? We broadly divided the causes of thrombocytopenia in 4 categories. First is decreased platelet survival. Second is decreased production of platelet. Third is sequestration, and fourth is dilutional. So in decreased platelet survival category, there is increased platelet destruction, maybe due to the immunological mechanism or non-immunological mechanism. In immunological mechanism, there are antibodies or immune complexes against the platelet. Primary autoimmune conditions for platelet destructions are acute or chronic immune thrombocytopenic purpura. Secondary autoimmune condition in which there is immunological platelet destruction is seen are SLE, post-transfusion, drug induced in some drugs like heparin, quinidine, and in some infection like HIV, CMV, and dengue, and in some cases of infectious mononucleosis. The non-immunological mechanisms. In non-immunological mechanism, there are some cases like or some conditions like DIC, disseminated intravascular coagulation, microangiopathic hemolytic anemias like TTP, thrombotic thrombocytopenic purpura, hemolytic uremic syndrome, and prosthetic cardiac valve. They result into the damage of the platelet and ultimately result into the decreased platelet count, and in some cases of giant hemangiomas. So this is the first category we have discussed. This decreased platelet survival may result into the or will result into the decreased platelet count. Now the second category is decreased platelet production from the bone marrow, which is seen in bone marrow failure syndrome like aplastic anemia and Fanconi anemia, condition which replaces the normal bone marrow like leukemias, metastasis, and granulomatous disease. There may be selective impairment of the platelet production, which is seen in some drugs like cytotoxic drugs, alcohol and thiazides, and some infection, measles and HIV may also result into the selective platelet destruction. And ineffective hematopoiesis may also result into the decreased platelet count, which is seen in myelodysplastic syndrome. And nutritional deficiencies, vitamin B12 and folate, may also result into the decreased platelet production and ultimately result into the thrombocytopenia. The third category is sequestration. Normally 30 to 35% platelets are sequestered and they remain into the or circulate into the spleen. But in case of hypersplenism, 60 to 70% of platelets are dumped or sequestered into the spleen and result into the decreased platelet count. In dilutional thrombocytopenia, after transfusion, most of the, as we know, the platelet has a lower lifespan, and when we transfuse or there is massive transfusion, the volume is replaced but the platelet are not replaced accordingly, so they will so this condition is result into the decreased platelet count. There is increased plasma volume in the condition of or a pregnancy, third trimester of pregnancy particularly, which may also result into the dilutional thrombocytopenia. So that's it for the thrombocytopenia. Thank you.